for taking the time to sit with me today. I appreciate it. Before we start, I just wanted to ask if you're okay with this being used on a website for like school purposes.
Sure.
Okay, then let's get started. So, can you go ahead and just like state your job and give a brief description of it?
So, my name is Anusha Jiwani, and I'm a pediatric cardiologist. Work at one of the university hospital in Houston, and I work with the children.
Okay. So can you give me like what does your schedule look like on a daily basis? What do you do in the morning? Just your day.
So it varies. Depend when we are on service or we are just doing an outpatient clinic. So more or less starts from 7:30, 8 o'clock in the morning, and it can go up to 5, 6, or maybe more longer. As you know, the doctors have no fixed schedule based on how sick your patients are. You stay as long as you need, but approximately 8 to 9 hours minimum time we spend in a day.
And what kind of patients do you see?
So as I said, I'm a pediatric cardiologist, so I see pediatric patients, but as a cardiologist, we deal with the disease of the heart in children. So our scope starts even before the baby is born. So we do what we call fetal evaluation. So when the moms are pregnant, we assess the fetus with ultrasound to check on the heart to make sure there is no defect in the heart or a rhythm problem with the heart. Because there are a lot of conditions which can run in the family, or due to maternal diseases, baby is at risk to develop those kind of heart problems. So our spectrum starts even before the babies are delivered. So maybe start from first trimester of the pregnancy. And then we have patients mostly up to 18 or 20 years old. And there are some patients who are born with the structural heart problem. They have a heart defect, or they have a missing chambers, or the problem in the valves. So we have patients, even adults, and the oldest patient I'm following right now is at 55 years old. Because a lot of adult general cardiologists, they're not comfortable seeing patients who are born with a complex structural heart problem. So we still follow a few patients who are older than 21.
That sounds really interesting. So what would you say your favorite part of your job is?
All the part of my job is interesting because that's my passion. So the most satisfying experience we get when we see patients get better and they go home and have a normal life. There are kids who are born with a complex heart problem. If you don't treat them in a timely manner, they may not survive. So when you diagnose them and then send them for surgery and they get better and they can have a normal lifestyle, that's the most satisfying aspect of my job.
So why did you choose this path as opposed to like any other path?
I was always interested in doing medicine, and I did graduate from different country. I'm not a USA graduate, and in that part of the world, kids are always interested doing one or the other aspect of the practical professional life. From very early in the middle school, they already make up their mind. You say maybe sometimes the family decide what you want to do. It's a cultural thing. But I always interested in doing medicine, so I choose that path. And cardiology is one of my favorite subjects, so that's why I decided to do cardiology.
But if you could go back, would you do anything differently?
Yes, I like more intervention. So I like invasive stuff. So if I have to go back, and I'm not regretting what I'm doing, I love it. But if I have to go back and restart again, then I will choose the surgical field. I would have been a cardiac surgeon rather than a cardiologist.
Interesting. So where did you go to school? Where did you go to college?
So I did my medical school in Pakistan, and then after my medical school, I came to US for further education. So I did my residency in New York, and then I did 3 years of specialization in pediatrics in New York, and then I did 4 year of cardiology specialization. So I spent enough time in Children's Hospital in New York, and then I worked in New York for a few years before I moved to Texas.
So what major were you in college?
So major was my biology, but it's a little different than what the school system here.
Right.
Back home is different. Back home was your school is up to 10th grade, and then 11th, 12th, which you do in school here, is considered a college there.
Okay.
So, and when you finish your school, then when you go in college, you already have to decide either you are pre-med or pre-engineering or commerce.
Right.
So after school, I went into pre-med, which is considered a biology track. So my major was biology.
So how would you say that's helped you in your career now?
So the college which you guys call here, it's a 4-year, and it's more of a broader aspects. A lot of things may or may not be applicable to your practical field, but what you learn, it always stays in the background and helps you. So nothing what you do in college is waste, but there we did college in 2 years, so it was very compact design course, and it was very rigorous. So we learned all the 4-year thing in 2 years, and a lot of things which when you look in a practical aspect, it does become applicable. So you learn about the biology. So you start with all doing dissections and learning about the system in the frogs and the cockroach and rabbits, and so that does apply when you go to medical school, because you're already familiar with the different systems of your body.
Right.
So it does help.
So when you were in college, did you do any like clubs or anything outside of school that's helping you now?
Yes, I was in a lot of clubs. I love sports. So back home was cricket is one of the favorite sports. So I was in a college team, and I played a cricket a lot. And then from the social or helping aspects, I was in few clubs where we do mentorship. So we help high school students and a college student who are preparing for their medical schooling. So we used to tutor them and mentor them free of charge. And so I had a lot of experience of teaching students, and I still teach. I'm in a university's academic situation, so I still teach students. And then I did do some health projects with the different teams. So even I went during my medical school, I went to the northern underserved area for 6 weeks. In those days, those underserved area did not even have electricity or the roads. So we had to go in mountains, walking, climbing the mountain, and I did serve with the health team to the checkups in the underserved areas. I love scouting, so I was in the scouts, did a lot of hiking and the camping and all those things.
So you mentioned already.
And let me tell you one more thing. So all those things, that comes very practical in your daily life, because you learn a lot of discipline when you're scouting. You learn a lot of discipline when you work with healthcare teams to go in underserved area. Then you realize the importance, how privileged we are, that we taking all those privileges granted. But I think we should respect all the privileges we have in this country, and try the maximum utilization of those resources we have here.
Of course, yeah. So you mentioned you're at a university hospital. So do you do any research at your job?
Yes, I do research. As I say, we have students, medical students, residents, and fellows who rotate with us all the time, and we do a lot of teaching. And along with that, because it's a university hospital, there's always we try to do research on different projects, and just we involve residents and fellows in our research, and that's how they learn how to do research in bench side or at the bedside.
Anything specific you're working on right now?
So right now we have few projects running. Most of our research we are doing in a neonatal unit, where we have a lot of babies who are born premature. You will be surprised. I don't know if you have any experience of seeing neonatal ICU. We have normally babies where when they're born 5 or 6 pounds or 7 pounds. We have babies who are born premature, so they are 1 pound, 1.5 pounds, like a can of soda. Okay, that's how they weigh, or maybe 2 cans of soda. So they weigh 4, 5, 600 grams. So we work a lot with premature babies, and they have a lot of issues with the extra blood vessels in the lung, and the lung get damaged. So we have couple of projects right now running. So how we can help those kids with doing medical aspects. I think it's more details to come, but we're trying to identify the ways to diagnose those issues without doing too many invasive testing. But just doing the blood test, we can diagnose those things, and we don't have to subject those tiny babies to all those x-rays and ultrasounds and all those things. So minimize those things. We're doing some non-invasive testing so we can help them out.
So lastly, do you have any advice for future health professionals?
Yes, get the maximum out of your education, the opportunities you have. But whatever you do in your life, you should be passionate about it. Because if you're not passionate about what you do, then it becomes a torture. So I've seen people who go in one or the other field looking at the financial aspect of that field. Oh, I want to make that much money. Yes, that's true. That's a practical aspect. But whatever you do, you should look at, do you have interest or passion about what you're doing? So that way you can be successful in what you do, and the money will follow you. Financial aspect always comes. So yes, I won't say no, but doctors do make reasonable income. But if you are passionate about that, because if you come into medicine, one thing is very important. You have to be passionate about what you do, and compassion is very important in our field. You have to be compassionate, respectful for the people who are sick. So to choose medicine is a very noble profession, and you have to have that feeling in your heart that you want to go serve those sick population so they can enjoy their life and they have a quality of life. So if you want to come into medicine, you have to have that compassion in your heart that yes, I want to help people. Yes, money will come with it, but you want to enjoy what you do, so you have a better quality of life and you help others to get better quality of life.
Okay, well, thank you so much for sitting down with me. Okay, so you said we're here in your clinic right now. So is there any instruments or anything that you can show me that you're using on a daily basis?
Sure. So I can show you a few things. Today is not a clinic day, so
right.
You won't be able to go in a patient area, and there's no patient here today.
Okay.
But yes, I will show you few tests which we do in our clinic, which is like a bread and butter for a pediatric cardiologist.
Okay.
And see if you're interested. As you know, the cardiologists deal with mostly the heart problems, right? So we deal with a structural heart problem and rhythm part of the heart.
Okay.
So the most basic test we do to diagnose the rhythm, I'm sure when you go, or maybe you have seen in those TV programs when you saw the ER, the first thing they attach is an EKG.
Yes.
It's called electrocardiogram. So this is the machine. It has multiple wires. There are 12 of them, and we attach different part of the chest. And then this is the machine. We get our EKG, which stands for electrocardiogram. So this is the EKG machine. So as I said, we diagnose the rhythm of the heart.
Right.
And this is what it comes out. This is what you call EKG, electrocardiogram. So it shows you how your heart rhythm is, how your heartbeat comes. And you have seen a lot of people who say, oh, I feel my heart skip beat, or my heart is beating too fast.
Right.
So sometimes you may not be able to diagnose or make your evaluation just based on this EKG, which is only for a few seconds. So sometimes if it's a rhythm problem, we do send them home with a special monitor. I'll just show you a quick. So this is a small monitor. It's hooked with a couple of wires on your chest, and it stays in your pocket. Nobody knows you're wearing it, and it can record your heartbeat for 48 hours. Or we have the ability to watch it remotely. Is like a telemetry, we call it, and somebody is watching your heart rhythm all the time. So if you're playing sports and you have abnormal heart rhythm, we can actually sit in our office and watch your heart rhythm. So that's technology is advancing, and sometimes we also use what we call exercise stress test. So a lot of athletes who wants to play sports and they have exercise related symptoms, we do what we call exercise stress test. So this look like a treadmill which you see in your gym. So this is a treadmill, this is a special treadmill, and what we do, we make patients run on the treadmill with a different speed, and every few minutes this treadmill goes up and goes faster. So it increases the amount of work you do, and same time you see all these select wires. These are attached to the patient's chest, and we can watch their heart rhythm here. That's called exercise stress test.
So like you're doing an EKG at the same time.
So EKG is only, we're running EKG, but in addition to the EKG, we also, with the exercise stress, we can diagnose a lot of other issues in their heart, how much oxygen you're consuming and all those things, energy consumption. So it has many more. It's just not a straightforward treadmill looking at the heart rhythm, but we can get out a lot of other information from this test. And another test we do, which I'll show you in a minute, is very important. As I told you, we deal with the most of the structure in the babies, the structural problem in the heart, the holes in the heart. So we do what we call echocardiograms. I'll show you that machine. This is one of our imaging room. This is called echo machine, echocardiogram machine. It's other word, this is an ultrasound machine. We check patients' heart through this machine, and it can show you the inside of the heart, all the valves and the different chambers, and how the heart is pumping, how the blood is going. So this machine is called it's pretty expensive machine. You can trade in your house with this machine. It's that expensive. So this is called echocardiogram machine, where you can check the inside of the heart. So these are the more common tests which a cardiologist's office use, especially in pediatrics. EKG machine, stress test machine, Holter, the monitor which they go home is called Holter monitor, and this is an echo machine which will look at the structure of the heart. So the child who's born with a heart problem go for surgery, so we can assess what the surgeon did inside the operating room by just doing an echocardiogram, and it helps us to manage patient's disease and how to proceed, what treatment to give, and all those things. So it's a very exciting field. Pediatric cardiology is very exciting and a challenging field, especially when you deal with the small babies. When you're doing sonogram, they cry, and then you have no control on it. So it's an art which you learn how to handle the small babies and the older kids. But it's a very exciting field, and I'm so happy that I'm in this field and making a difference in the children's life. And I hope all the people who are planning to go in the medical field, go for it. It's a very excellent field to choose, but make sure you should have a compassion for what you do, and you will be succeeded. Thank you.
Thank you. Well, thank you so much for taking the time out to do this interview with me. It was really helpful and really interesting.
No, you are welcome, and it's my pleasure.